Treating hair loss sufferers who have agreed to take DHT blockers is also very challenging. The way the body behaves, distinct individual metabolism, lifetime goals of a patient, and the innate psychology of the patient who's taking DHT blockers dictate that the regimen is tightly monitored and titrated from time to time depending upon various factors which we will discuss. So that with the best drug using the minimum dosage, the patient gets maximum result without much side effects or no side effects at all. Though this works in the vast majority of patients, there is a small minority in which there are problems. Now, this talk is in response to a question asked by a patient. Doctor, since we're blocking only 70% of DHT by using finasteride and 90% of DHT by using dutasteride, why don't we block 100% of DHT so that we get good regrowth? Well, DHT has got many other functions. So it is not very easy to play around with hormones so much. Why we do not block 100% of the receptors is because the body will upregulate. The body will seek to achieve an equilibrium, and this will negate the effects, the good effects of finasteride or dutasteride. This phenomenon, which is occasionally seen, fortunately it is quite rare, and it's called reflex hyperandrogenicity, and that is the topic for the day. This phenomenon of reflex hyperandrogenicity overcomes the beneficial effects of finasteride and dutasteride. It has been seen on many occasions that in certain individuals, even if they're not taking too much of drug, too high a dosage of finasteride, after some time, the negative side effects, if they had occurred in that patient, will disappear. And the hair start falling. It is as if he has not been taking finasteride ever. And when this occurs, how it occurs, how much it occurs, is not known. The patient starts to feel that his oil glands are secreting more oil. There is more pimple formation on the face. And the libido, that if he had a side effect of decreased libido by using finasteride, has become better than usual. This is because the body has upregulated. The body has responded to certain stimuli in the body in response to decreasing levels of DHT and increase the hypersensitivity of its receptors. But the good news is that this is a very rare phenomenon. It doesn't happen in everybody. People have taken high doses of finasteride, up to 5 milligram twice a day I've seen, but they have not reported reflex hyperandrogenicity. So the fortunate thing here is that this is a rare phenomenon, but even though rare, it is important that you know about it. So to understand reflex hyperandrogenicity, we need to have a basic working knowledge of how hormones are upregulated and downregulated in the human body. Although a given hormone like DHT might travel in the bloodstream to all parts, it will affect only the target organs. And this is determined by the presence of receptors on the target cells. These hormones bind to the target cells, sets off a chain of events which initiate the response in the target cells. Now, this response contributes to various functions in the body, like human reproduction, development of body tissues, metabolism, sleep regulation, electrolyte balance, and a host of other functions, which will be too much to elaborate in this talk. So when we set out regulating hormones in the body, if the body feels that the hormone requirement of the body is not being met, it has an inbuilt mechanism of autoregulation. And this increased availability of hormone to the body is achieved by a mechanism called upregulation. So what do you mean by upregulation? Upregulation is a mechanism by which the body readjusts itself. It recalibrates its response to certain stimuli. If the hormonal levels are less, if the hormone availability to the body is less, the body will upregulate. By upregulation, we mean that it will increase the hormonal receptors on the plasma membrane of cells. And this will increase the availability of hormone to various target cells and target organs. The commonest example is increasing of oxytocin receptors on the uterine cell membrane in a person with late trimester pregnancy in preparation for labor. Now, these receptors on the smooth muscles of the uterus get activated and become hypersensitive and show excessive response to oxytocin and start to contract and initiate labor. This is to facilitate childbirth. So this is how the body upregulates and downregulates. Receptors are made of protein, and this protein, which becomes specialized receptors, is manufactured by the cell itself, and they are present on the cell membrane. Whenever the body senses that the hormonal levels are more or less, it will readjust itself, trying to seek an equilibrium by upregulating or downregulating. When these cells increase the number of receptors, it is called upregulation, and when the number of receptors on the cell membrane are decreased, it is called downregulation. Though the commonest way of upregulation is increasing the number of receptors on the cell membrane, there are other two mechanisms by which the body can regulate the level of hormones, and these are, number one, by decreasing the degradation of receptors, and secondly, by activating latent receptors. So these are the three mechanisms. One is by increasing the number of receptors in the cell membrane. Number two, by decreasing the degradation of receptors, which is a natural process. Lastly, by activating latent receptors. So similarly, when DHT levels are decreased due to use of finasteride or dutasteride, and the body senses that its requirement for DHT in other body functions is not met, it will upregulate. And this can happen also by increasing the production of hormone, and secondly by upregulating, which has been described. And this increase in DHT levels will happen by increasing the amount of hormone being produced by the body, or by increasing the sensitivity of the receptors to DHT. So when does reflex hyperandrogenicity happen and when does it not happen? Because the body is constantly upregulating and downregulating. But then, even in patients who have very low levels of DHT, reflex hyperandrogenicity does not take place. Well, this has got something to do with the metabolism of the patient. When this process of upregulation goes uncontrolled, it overshoots itself. Symptoms of reflex hyperandrogenicity start to manifest themselves. And this can be markedly increased libido, which the patient might not have known for many years, increased oil gland secretion, especially on the face, and increased number of pimples on the face. This can be like late onset acne. So to end the talk, a mix of upregulation and downregulation is a response by the body to achieve an equilibrium so that the hormonal demands of the body for other bodily functions are met. So the aim of this talk is to enlighten you that it is not so simple that you pick up a drug from the counter and start taking it. Starting a drug and maintaining the drug, decreasing the dose at times and increasing the dose at other times, or supplementing it with other drugs is a specialized field. The response of the drug is different from person to person. You can't have just one dose, say 1 milligram finasteride throughout your life is not sufficient. So there is no single dose that will benefit all hair loss sufferers. In one patient, 1 milligram may be too little, and in another patient, 1 milligram may be too much. There are people taking 5 milligrams a day and there are no problems whatsoever. So there is a wide range of patients with varying responses to various doses to finasteride or dutasteride. So in brief, dose modulation and microdosing are far too complex to follow this yourself on the advice of various forums, on the advice of various social media proponents. So in brief, dose modulation and microdosing are far too complex to take this in your own hands. It goes without saying that you need a doctor to guide you through. Well, if you liked my video, please don't forget to subscribe. And thank you for watching the video. Stay safe and God bless.